This series of videos have been developed by Public Health Services. The sessions are designed to provide self-directed learning and cover the basics of infection prevention and control. This session is about environmental cleaning. From this session, you will have an understanding of cleaning of the healthcare environment, including blood and body fluid spills management. Standard precautions refer to work practices that are applied to everyone, regardless of their perceived or confirmed infectious status, and other minimum level of infection prevention and control precautions that are required. Performing routine cleaning of the environment is a key element of standard precautions. Healthcare-associated infections are linked to environmental cleanliness. Organisms can survive in the environment, and there is a risk of transmission to patients. Transmission from the environment to patients may occur directly from contaminated equipment or indirectly, such as on healthcare worker hands. All surfaces in the environment require regular cleaning. Some surfaces are touched more frequently and require more frequent cleaning than those surfaces which are not often touched. Environmental surfaces can be classified high or minimal touch surfaces based on frequency of hand contact. High touch surfaces are the surfaces that are in close proximity to the patient and are frequently touched by patient, healthcare worker or visitors' hands. These surfaces include items like the bed rails, the call bell, bedside locker, door handles, patient chair, tap handles, and the patient tray table. Minimal hand touch surfaces are surfaces that are not often touched by hands. These surfaces include windows, shelves, walls, and the floor. These items require regularly scheduled cleaning, but not to the same frequency as high touch surfaces. Routine cleaning with a pH-neutral detergent removes organisms from the healthcare environment and reduces the risk of transmission from surfaces and equipment. An important part of cleaning is allowing for the surface to dry. The general principles of cleaning are to clean from high to low surfaces and from clean to dirty areas. For example, clean the walls before the floor and the patient room before the bathroom. The use of a disinfectant is required in some situations. The decision to use a disinfectant is based on the services provided in the facility and the risk of infection to the patients. Factors influencing this decision include the number of patients with multi-resistant organisms or other infectious agents requiring transmission-based precautions, or an outbreak situation. You cannot disinfect something that is not clean. Therefore, before using a disinfectant, it is important to first clean a surface or item with detergent. 2-in-1 detergent and disinfectant wipes are available and are a good option for small items. All organisations should have a documented cleaning schedule that outlines responsibilities for staff, including the duties and frequency of cleaning required and products to be used. Schedules should be developed within organisations reflecting the types of services provided and the risk of transmission of infection. All staff undertaking cleaning duties must be appropriately trained and provided with ongoing education to ensure they are competent and supported in their role. Blood and body fluid spills are inevitable in healthcare facilities. It is important to clean the area promptly, wearing appropriate PPE. Confine and contain the spill with absorbent material and discard it into a bin. Clean the area with detergent and consider using a disinfectant based on the volume of the spill and where it has occurred. Ensure that after removing PPE, hand hygiene is performed. Environmental hygiene is an important element of standard precautions. There is a correlation between poor environmental hygiene and healthcare-associated infections. Routine, structured cleaning with a pH neutral detergent removes organisms from the healthcare environment and reduces the risk of transmission from surfaces and equipment. Use a disinfectant in some circumstances. This session has been based on the Australian Guidelines for the Prevention and Control of Infection in Healthcare. Thank you to the Australian Commission on Safety and Quality in Healthcare for permission to use their standardised infection prevention and control signs.